Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We have a lot of different topics to cover today, but before we get to them, let me point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. You can go there, subscribe for free, and it has all of the background material and links to studies and research, as well as a lot of healthcare related recommendations and organizations you may want to join. So let's get started. First, let's talk about the RSV vaccine. Since its introduction last year, researchers have been monitoring the real-world impact of the new respiratory syncytial virus, RSV vaccines. It's brand new, right? RSV is a significant cause of severe respiratory illness among older adults, especially those with underlying health conditions. Worldwide, RSV causes millions of infections, hundreds of thousands of hospitalizations, and tens of thousands of deaths annually in the U.S. Annually worldwide in adults age 60 and older. Now, in the U.S., adults over 65 experience high rates of RSV-related hospital visits. They get to intensive care unit admissions, and there have even been deaths. Older people with RSV are at higher risk of severe illness compared to those with just influenza or COVID. So this is a serious item. Now, a recent study just a couple of days ago was published in The Lancet, the British medical journal, and they assessed the effectiveness of RSV vaccines using data from a large electronic health record network involving the Center for Disease Control and Prevention and multiple U.S. healthcare systems. The study found that RSV vaccines were 80% effective in preventing hospitalization. That is so high. Hospitalization, ICU admission, and death. So this is an incredibly effective vaccine. All of this for people age 60 and older. So 80% effective in preventing hospitalization, ICU admission, and death if you're 60 and over. Great. Vaccine effectiveness rate was consistent across age groups, including those 75 and older, and among immunocompromised individuals. So this thing just works for everybody. The study did not find evidence of waning vaccine protection within the season, so that's pretty good. However, the uptake of RSV in the 2023-2024 winter season, so that's last year, was very low. An estimated only 24% of U.S. adults aged 60 and older got the vaccine, compared with the influenza vaccine, which was about 50% each year for that same age group. There's a link to this story in Science Daily, but I got to tell you, I'm shocked. Only 50% of senior citizens get the flu shot? What in the hell is going on? I can understand that RSV was not covered by traditional Medicare last year. So if you did not have a drug plans actually paid for it. But if you didn't have a drug plan, the uptake price was high. They had copays of about $300. This year, I'm hoping for way less, and all of you that are 60 and over, go get it. If you can get it, do it. And you know what? While you're there, that in one arm, flu shot in the other, make sure you're up to date on COVID. Let me talk briefly about telehealth, because it turns out that telehealth care works well and is cost effective throughout the system. Now, a University of Michigan study just came out, suggests that policymakers can rest easier about one of the top worries regarding telehealth. This one didn't occur to me, but it occurred to others, is that virtual care will drive up the use of tests and scans that patients don't really need, wasting money and resources, which are of course valuable. In fact, the study, which was just published in the Journal of the American Medical Association, link to it in the newsletter, shows that low-value care didn't rise faster at primary care practices that used telehealth the most, compared with those that used it the least. And in some cases, the high telehealth use practices saw a faster drop in low-value care. The study focused on 8 low-value test scans and procedures that experts agree just generally aren't needed in certain age groups of patients. This included blood tests to screen for prostate cancer in men over 75, CAT scans for people with uncomplicated sinus infections, come on, or back pain, pap smears to look for early signs of cervical cancer in women over 65, and colon cancer screening in people over 85. Now, some people worried that such low-value care might rise when physicians and other providers see more patients virtually and just can't conduct physical exams. The study showed this does not happen. Another fear about virtual care was that the rate of in-person visits would increase because of a need for follow-up appointments to address something identified in the virtual visit. Good news. Data from 2022 shows that the rate of in-person visits actually decreased in the telehealth era. Apparently, hold on to this, people were behaving rationally. Just hold on to that because it's so rare. Okay, let's talk about nutrition, which is a part of healthcare. I am writing this article on nutrition because the Trump administration is looking to give money to the wealthy by cutting services to the poor. This is a long-standing Republican, it's not a meme, it is a behavior, and if you speak Yiddish, it is a shanda. One of the places that they would like to cut is nutrition assistance. Bigger shanda. The House version of the Farm Bill that passed out of the Agriculture Committee earlier this year calls for a $30 billion cut to SNAP, which is food stamps, over the next decade. In fiscal year 2022, children made up about 40% of those receiving supplemental nutrition assistance, SNAP. Children under 5 made up 12% of the participants, and school-age children 28%. In fiscal year 2023, SNAP served an average of, get this, 42.1 million participants every month. Did you know that? Federal SNAP spending, this is from the U.S. Department of Agriculture website. They manage SNAP, and of course, because they're taking stuff from farmers and giving it to people who are hungry. Anyway, if you go down in the YouTube description box to the link for the newsletter, you can get to their website and just read this stuff. They spent $112.8 billion in a year, $211.93 per participant per month. That's at the USDA website. Did you get that? There are 335 million people in the United States. 42 million of them need nutrition assistance, 12.5%. That's a huge, huge number of people that are poor in this country. According to the National Council on Aging, about 3 out of 5 seniors who qualify for SNAP are not receiving benefits, meaning that a significant portion of eligible seniors are missing out on food assistance. They're going hungry. This translates to about 5 million people nationwide. This is a little complicated, but many of those 5 million people choose not to apply because they are embarrassed to ask for help. I got to tell you, with my family, when I was growing up, it was that way, but it doesn't have to be that way. Qualify for nutrition assistance. I have a link to the federal website to determine if you or someone you know may qualify for federal assistance for food. There's also a link on that federal website to help you find a food bank that will provide donated food. If you know somebody hungry, make use of this. There is a link on that federal website to each state's nutrition assistance program. And you know what? Those programs all have a phone number listed. You can get in touch with them for you or for somebody you know that needs help. Do it. There are 3 tests to qualify for nutritional assistance. Your gross monthly income has to fall below a certain threshold. You have to not have significant assets available, and your net income has to be below a certain threshold. Personal action for all of us. If you know someone who might qualify for nutrition assistance, help them get help. Use the resources in the newsletter and get them help. Find a food bank for them. Make sure that they're eating. Apply for SNAP for them. Do them a mitzvah and just do that. Anyway, here's a nationwide action because I'm so pissed about the House of Representatives wanting to cut this. I want you to contact your federal representatives and let them know not to cut nutritional assistance as we head to funding discussions, which we always seem to be doing. Here's a link in the newsletter where you can call or email them if you want, or use my favorite method, ResistBot. All you have to do is on your cell phone, send a text message to 50409, that's ResistBot. The message is sign, S-I-G-N, space, P-Y-J-Y-B-I. Sign, P-Y-J-Y-B-I to 50409. And here's what you're going to send. I'm your constituent, and I see that the House version of the Farm Bill has $30 billion in cuts to nutrition assistance, SNAP, over the next decade. Do you know how many people rely on that nutritional assistance? 12.5% of us, 42 million people every month, and a large number of them are children. And if that weren't bad enough, there are 5 million elderly out there that qualify but aren't getting their benefits. There are a few things I want you to do. Recognize that we have a poverty problem in this country. 42 million people don't have enough money for food. Encourage seniors to get food assistance that they need. Remember, those 5 million seniors I mentioned, they're not part of that 42 million. Be creative. Make applying easier. Advertise. Get it on the 10 o'clock news. Do something. And do not implement any cuts to SNAP in the Farm Bill. Thank you. That's what I've got for you today. Please take these actions. You can send me comments down below. You can like, share, and subscribe. You can also ask for research topics to be done, either here in the YouTube description box or send it to me at healthcareadvocacy1, all one word, @gmail.com. Thank you. I look forward to talking to you later. Bye-bye.